NCLEX pattern was adjusted because of lack of testing center and the heightened demand for international nurses to come and practice in United States of America. So it came from what it used to be, that's 265 questions for a period of 5 hours. It came down to maximum question of 145, still the same 5 hours duration. Then a candidate is expected to take 75 questions, that is the minimum, and 145 questions, the maximum. But since April 2023, 1st of April, Next Generation NCLEX was launched, and since then, there has been a lot of changes. So today at eLab, we are introducing you to the Next Generation NCLEX. Here, eLab will assist you to achieve your US registered nurse licensure status this year. And as God may have it, presently in Saudi Arabia, we already have a tentative testing center for people. So we hope that in time to come, maybe in less than a month, people will start testing in these locations. So the Next Generation NCLEX is a new era in nursing assessment, preparing nurses for the challenges of modern healthcare, embracing change for better clinical judgments. So the overview, understanding the Next Generation NCLEX, it represents a significant shift in nursing examination, developed to better measure clinical judgments essential for nursing practice, a response to evolving healthcare needs, increased complexity in patient care. It's also aimed at reducing errors through improved decision-making skills, a collaborative effort guided by National Council State Board of Nursing. So this council oversees the affairs of nursing throughout the 52 states in United States of America. So they also coordinate this NCLEX RN exam and that of PN. So as we move further, I will try to elaborate on why the change. So the rationale behind the change. In the year 2013/2014, National Council State Board of Nursing Strategic Practice Analysis identified gaps in nursing assessment, increasing complexity in patient illnesses demands higher clinical acumen. Technological advancements in healthcare necessitate updated nursing skills, a proactive steps towards reducing clinical errors and improving patient outcome. Next Generation NCLEX focuses on clinical decision-making, a critical skill for modern nursing. So this Next Generation NCLEX was created by National Council State Board of Nursing Judgment, a new framework. They structured NCJMM, a structured approach to assess clinical judgment, focus on recognizing cues, analyzing them, prioritizing hypotheses, encouraging generating solutions, taking actions, and evaluating outcome, builds on traditional nursing processes with an emphasis on decision making. A six-step process forming the backbone of Next Generation NCLEX assessment strategy. So this is more like our nursing process in our clinical setting. If we can recall vividly, our nursing process involves six steps. So the Next Generation NCLEX try to inculcate all these steps in the exam so that they can have a vivid analysis of each candidate performance in every aspect of nursing. So we are not only looking at the nursing steps only, they involve other aspects of nursing also. So as we move further, you will understand better. Implementation timeline. Official launch of Next Generation NCLEX was on 1st of April 2023. This implies that students that began their nursing school in the fall of 2021 were the first to experience Next Generation NCLEX. These are international students that studied in the United States of America. So a transition period for educators and students to adapt to the new format makes a significant shift in nursing education and assessment. So what are the key changes? What are the things that changed about this Next Generation course? So the first and foremost, there is enhanced version of the current NCLEX, not a separate exam. Introduction of new item types for a more dynamic assessment. Updates include extended multiple response, more like a case scenario, because this Next Generation NCLEX is more like a case scenario. They will give you scenario of what is happening with the patients. So you have to follow up with the nurse's notes, patient vital signs, other developments, and sometimes there are many trends that occur. So they have an extended question. So the key thing we do is to write down the keywords so that as we read the question or advance further, we will not have to maybe have difficulty recalling what we have read so far. So drag and drop and more. Case studies and clinical judgment items to reflect real world scenario. Revised test design and length coupled with a new scoring methodology. So we have different question types for this Next Generation NCLEX. At first, the question is extended multiple response, meaning that after after you answer the first question, there are sequel of questions that follows. It's not just that the first question. You have follow-up question. That is why you have to read the case scenario before you very well, then jot down the key points so that as you move on, you will remember. You can easily recall. A moment, please. I have to switch my slide. I hope we can all see the slide. Sorry about the brief interruption. Hmm. So I was talking about the clinical judgment model, measurement model. So before us now, we have a display. Can we see what is before us? So clinically, the National Council State Board of Nursing is trying to assess an individual nurse's clinical judgment, how the individual is able to recognize cues, analyze cues, prioritize hypotheses, generate solution, and take action. Not only that, they also embrace the steps of nursing process. If you can recall vividly, I once mentioned that this next generation NCLEX, whenever you see it, is a long, usually a long question that follows like 6 steps. So for you to complete one question, you have to have many other questions following it. That's after the first case scenario and the questions that it comes with. You still have more 5 questions to go. And they are trying to bring it home using our nursing process of assessment, analyzing, planning, implementation, evaluation. So also, the NCLEX exam recently, it is not just about next generation NCLEX. It still has the old pattern, which is computer adaptive testing. We'll get into that as we move on. So I once talk about the type of questions we see in next generation NCLEX. Updated updates include extended multiple response, drag and drop. What drag and drop implies is um, after reading your questions, the options will be lined below. So let me say the question is expecting like 3 correct options from you, but the options you have is up to 6. So for a drag and drop question type, you have to go to the options. Among the 6 of them, drag the correct one, meaning that you have to double click the correct one, then still maintain your hand on the cursor, then move it to the space provided for you to place your answer. So that way, when you move them that way, you'll be left with those questions that you did not want to select in the list of options. Then another way you can see a drag and drop question is when you are asked to list your actions in order of priority. Priority means first thing first. Which one of these comes first? So in this scenario, you have to look at every item on the option. Use the rough paper given to you before the start of exam to itemize which one comes first. When you're done with that, it is now easy for you to take your mouse, double click the option that you think is the first action you will take. When you double click it, you take it uppermost to place it in the first option in that line of actions. So that way you see those um, options moving. But if you don't double click, you cannot be able to drag that option uppermost. So case studies and clinical judgment item to reflect real world scenario. Revise test design and length coupled with new scoring methodology. We'll see all that as we move on. So this is another question type, a bow tie. If you look at it now, you see bow tie is this tie that children use, also adult men uses it, just like a bow. So this is a question format. And it says complete the diagram by dragging from the choices below to specify what condition the client is most likely experiencing. Two actions the nurse should take to address the condition and two parameters the nurse should monitor to assess the client's progress. So the first thing you do here is to select the patient's condition, which is at the center. When you have selected the patient's condition, then you go over to the actions. From the list of options below, you will now select what you can do for this patient in this condition. After you must have done this, then you move over to select what you monitor, what you will follow up on the patient, and it must have to be two. When you're done with this, then you can now move to the next question. So this is another type of next generation NCLEX question type. So this one is matrix grid question. Do you understand? So here, a 12-year-old is evaluated for an acute illness. The nurse reviews the symptoms reported by the patient client, pediatric client's parents. The nurse assists with the differential diagnosis. For each symptom, choose the condition for which the team evaluates. It's more like asking us, for any condition this patient has, what are the clinical states? What are the signs and symptoms that the patient will present? So here, it is left for us. The first condition here is head injury. For a patient that has head injury, is this patient having headache? Yes or no? Yes. One of the clinical signs, they have headache. So we are going to take this. But if this patient is not having headache, there is no point taking it. You have to omit it. So the second one is vomiting. For a patient with head injury, yes, they have vomiting. For patients with head injury, do they have poor balance? Do they have problem balancing? Yes, sometimes they have dizziness. Do they have lethargy? Yes. So for head injury, you will see that all these, you have to choose them. You have to choose headache, vomiting, poor balance, and lethargy. The same thing also applies to meningitis. So these are the type of question you see. When you see them, you know how to approach them. So this one is another question types. What we call this one is trend. It is also inculcated in the new generation NCLEX. We call this one trend because as time goes on, as time passes, patients, you'll be giving updates on what happened to the patient. And based on that, you have to act. So look at this one. At 11:09, a 5-year-old client with no past medical history presents accompanied by a parent. By the parent accompanying the client had lost balance while playing, and the parent grabbed the client's left arm to prevent them from falling. The client began to cry and has not used the arm since. Since means since the incident happened. So this happened 11:09. So let's look at what happened 6 minutes later. So the client is acting age appropriate. Remember the child is 5 years, correct? So it's acting according to what people in the same age will still do. So, and is guarded by the staff and claimed to the parent while attempting to access the injured arm. The client pulls away, cries, verbalizes pain. There is a presence of +2 radial pulses bilaterally and brisk capillary refill. That is less than 2 seconds, meaning that patient is having adequate perfusion to the affected arm and the pulsation is adequate. So a trend may continue like this until maybe we are told that our patients develop something. So when a question comes up after this trend, it is expected of us to have information from the start to the finish, what the patient presents with, so that you'll be able to make a clinical decision. So in front of us is another question type, a highlight. So this is a patient that comes for delivery. A 30-year-old, gravida 3 para 2 at 38 weeks gestation with history of regular prenatal care and gestational diabetics mellitus, comes for induction of labor. Okay. I have to play the one before it. Okay. Comes for induction of labor secondary to poorly controlled blood glucose and estimated fetal weight of 8 pounds, 13 ounce. Client is taking insulin. Client receive an insulin infusion for glucose control and IV oxytocin for 6 hours. The fetal head was delivered in the right occipital anterior position. McRoberts maneuver and suprapubic pressure performed to relieve anterior shoulder impaction. Right mediolateral episiotomy and delivery of posterior arm performed. Placenta spontaneously delivered within 15 minutes and intact. Episiotomy repaired and good hemostasis noted. Quantity of blood loss recorded was 400 ml and the fundus was firm, meaning that the bleeding has been controlled. So for the newborn, the baby is viable infant, 10 pounds, which is equivalent to 4.5 kg or 4,535 grams with ABGA score of 7 at 1 minute and 9 at 5 minutes. Crepitus noted over the right humerus and a moral reflex not present on the right side. The delivery time was at 13:00, that's 1 p.m. So looking at this is giving us a case scenario of how a 30-year-old woman in labor who is diabetic. So these are the things that happen, and eventually the baby was delivered. But because this woman has gestational diabetes, this question comes up. Look at the question above. The nurse has reviewed the information from the progress note. So you are now asked to click to highlight below the three findings that indicate a complication of gestational diabetes and associated fetal macrosomia. What are the things listed in this write-up that is telling us that there is complication? Because looking at it now, complications of gestational diabetes and fetal macrosomia. The baby is big. So I will go back so that we'll see. So for the highlights, you are expected to go to the body of the question and click. So anyone you think is a problem or a complication to this scenario, you have to click. So the first thing we have here is macrobot maneuver and suprapubic pressure performed to relieve the anterior shoulder, telling you that because this baby is big, there is shoulder impaction. And for that reason, this maneuver has to be performed. So the second thing that is we have in this highlight is right mediolateral episiotomy. For a baby, a normal baby weighing 2.5 to 3.5 kg might not, the mother might not need episiotomy to deliver the baby because the size of the baby is still normal and adequate for the pelvis. But for this reason, the mothers had to receive a mediolateral episiotomy and delivery of posterior arm to be performed. So what else is the complication here? Crepitus noted on the right humerus and moral reflex not present on the right side, meaning that the baby has brachial plexus injury while the shoulder is being delivered. The baby has a problem, the mother has an episiotomy, and there is also shoulder impaction. So these are the three complications here. So this is what a highlight question type looks like. So exploring next generation NCLEX items, I've mentioned this before. So it's also good that we've seen the sample also. So, but I'll go through it again. Extended multiple response, in-depth analysis of clinical scenarios, extended drag and drop. You can see a lot of drag and drop. Just pay attention. They are part of your exam. So they are part of the skills that you need to showcase for you to be judged. So don't say that this exam is so bulky, I cannot move on. You can do it. That is why we are here to prepare you. So interactive assessment of decision making. Then a close, click or drag answer option to complete the clinical statement. So this is more like a, you have to pick a sentence to complete the question you're being asked. Then a highlight test I just showed you. Identifying key information in a given scenario. So you have to take your mouse, go to the body of that to click. Anyone, depending on the number you're asked to select, anyone you click is already marked. So maybe peradventure you made a mistake and you wanted to correct. You have to deselect one of the options in order to select the correct one. Then matrix slash grid I've showed you, bow tie trend. So these are all the question types we have. So let's talk about how this next generation NCLEX is being scored. Like I said before April 1st, 2023, that's before the introduction of this next generation, we used to have a total of 145 questions. That's for maximum for 5 hours and minimum 75 questions. So when this next generation NCLEX was introduced, we started having 85 questions minimum and maximum 150 questions. This means that every candidate will not have the same number of questions. Then I would like to say at this point that at 85 questions, at your 85 question, and the system is still giving you more questions, it basically means that the system has not made clinical judgment based on your performance. The system is still giving you the opportunity to show them the stuff you're made of, show them how prepared you came. So don't expect just that 85 question. Expect to get to the maximum, because most students um within this couple of time, we've noticed that students will be like, I want my system to shut down at 85 question, or I want to have just 85 question, maximum 90. And for someone who have preconditioned his or her mind to have just 85 question, when your question exceed that 85 question, the candidate might start being worried. And in that state, you cannot actually read the questions that are coming very well to pick the correct option. So what I advise every candidate is to go to the exam, go prepared, tell yourself, I must do this once and for all, and I must get a maximum of 150 questions. So on the day of your exam, if your computer shut down at 85, good. That means the computer has made enough decision that you have passed this exam or you have failed this exam. The same decision can be made in between this minimum and maximum. It can be made at 90 question, it can be made at 92, it can be made at 100, it can be made at 101. It depends. It can be made at 149. You have enough time to tell them that you actually studied well for the NCLEX exam. So I'm not telling anyone to go there to rush. No, you have to take your time, read the question carefully, then select your exam. So there is also incorporate 52 standalone question. So you have single question like 52 and up to 5 case studies. So if you have 5 case studies, one case study has 6 questions altogether. So one case study, 6 questions, one case study, 6 questions. So let's talk about the scoring system, how it is scored. So the good news about this next generation NCLEX is that there is partial credit. For instance, if you're given something like select all that apply question, before this next generation, if you fail any of the option, let me say you have a list of 5 options and 1, 2, 3 is the correct option, but you ended up selecting 1, 2, 3, 4. Because you selected 4, you have failed everything. But for this next generation NCLEX, If you end up selecting extra that is not part of the correct answer, 1 mark will be removed from the ones you got correct, meaning that you did not lose everything. Let me say, for this one I just explained now, correct answer is 1, 2, 3. You selected 1, 2, 3, 4. So meaning that you will lose 1 mark, having like 2 over 3. Because you selected extra, you will lose one of your mark, because the totality of the score for this question should be 3 over 3. If you get all, that's 3 over 3. If you didn't get any of them, it should be 0 over 3. But this one, you selected all, you got all right, then you selected extra. So you will lose 1, having 2 over 3. I think it's a bonus. I think it's a credit. Instead of losing all the score, losing the 2 marks because you selected an extra. So that is the benefit of partial credit. The next generation offer partial credits in their scoring. So the scoring rules include 0 over 1, then plus or minus scoring, the one I just explained now. Then rationale scoring, a more nuanced approach to evaluate a candidate's clinical judgment. So let's briefly talk about the computer adaptive testing. Consistent aspects in next generation NCLEX. Despite changes, core elements of next generation, core elements of NCLEX remain unchanged. Time allocation for the exam continues as up to 5 hours. So you still have 5 hours length of time to complete your exam. So the exam remains a variable length computerized adaptive test. The candidate's performance report format will be familiar. Aim to maintain a balance between new challenges and familiar setting. So for this computer adaptive test, if you do well, you will get harder question. But when you're doing poor, your question will be easier or on the average. It will be very easy on the average. So that is why you have to tackle every question as if it is the highest question you have. Don't say I wasn't taught this. You have to think it out. You have to reason the scenarios around it. You have to take it one after the other to see if you can actually find your way around it. So for we at eLab Solution, we will help you to adjust to this next generation NCLEX by familiarizing you with the NCJMM, that's the new National Council Judgment method for this next generation NCLEX to integrate new practices into nursing curriculum, incorporate new next generation NCLEX sample item into teaching and assessment, align curriculum with clinical judgment, focus on next NCLEX, then utilize resources like UWorld for high quality next generation NCLEX style practice question. At eLab, assist our students with such subscription. So educators should align their item writing with National Council judgment for best practice. So ensuring quality in next generation NCLEX item. Each NGN case study undergoes over 40 hours of development. They focus on correct, relevant, evidence-based practice in terms of creation, striving for bias-free items that effectively discriminate between different ability levels. Commitment to developing valid and reliable tests for nursing students. UWorld offers a comprehensive platform for next generation NCLEX preparation. eLab is equally developing her own next generation NCLEX question. So getting started with this next generation NCLEX, seek out online platform providing next generation NCLEX. Focus on resources that offer content-rich rationale and illustration. And that remind me, in our academy, we don't joke with rationale. If you have a follow-up question after a class, you're expected to put your rationale, the reason behind your choice of answer. Start building clinical judgment skills through next generation NCLEX case studies. Stay updated with latest next generation NCLEX news. Update from eLab Academy. Proactive preparation is the key to succeeding in updated exam formats. Embracing the next generation. The NGN represents a significant advancement in nursing education. It aims to equip nurses with the skills necessary for modern healthcare, encourages continuous learning and adaptation to changing healthcare environments, an opportunity to evaluate standard of nursing practice globally. So we from eLab Academy, we have the structures, we have the classes, we have the tutors to help you in this journey. So you can contact us for your registration depending on the class you would like to join. The number is on the screen. You can take a screenshot or maybe take a picture. So with this, you can stay connected. For more information and updates, contact eLab Academy with this number on WhatsApp +234-816-563-4195. Always open for inquiry, suggestion, and further discussion on NCLEX preparation. Thank you, everyone, and God bless you. So this is the time for question and answer. If you have any question, you can unmute yourself and ask. Yeah, Sister Fatima, I can see your hand. Can you ask your question, please?
Hello, ma. Good evening.
Yeah, good evening.
My question is necklace exam. If
Mm.
I'm to write it, where can I get a job outside?
Where and where can you do what?
Job with necklace exam.
Where you can get job.
Assuming I wrote necklace exam and pass.
Okay.
In which country can I get job with necklace exams?
Okay, you can use it for New Zealand, Canada, Australia, and USA.
Oh, okay. Okay, thank you very much.
It depends on which of the country you want to relocate to. United States of America, New Zealand, Canada, Australia. They now require NCLEX. All of them.
Thank you.
No problem. Any other question? Sister Ugwanyi, do you have a question for us? Unmute yourself. Unmute yourself. Okay, Sister Eso, go
Can
ahead.
you hear me
Unmute
now?
yourself. Yes, I can hear you, Sister Ugwanyi.
Okay. Thank you very much for the wonderful presentation. So my
You're welcome.
question goes like this. Like if somebody decide to write this exam, like a minimum of how many months do you need to follow up the class?
Okay, minimum is 4 months.
Okay,
Minimum,
so you have to be attentive
depending on,
for 4 months.
minimum is 4 months, but within 4 to 6 months, you are academically prepared and ready to write the exam. So far, you're following the academy religiously, not
Okay.
haphazardly, religiously, okay?
Let me just okay.
Mm,
Thank you.
yeah. With Sister Olayiwola, can you unmute yourself and ask your question, please?
All right. Good evening. Thank you
Yeah,
for
good
the
evening.
thank you for the wonderful class. So useful.
You're welcome.
Yeah, my question is of two parts. So the other sister have asked one of the question. I wanted to ask that is it that each month is for each like NCLEX is it level one, then NCLEX level two? Is it that each one is for each month?
Yes,
And the
exactly.
okay,
Each
okay.
is for 4 weeks, but for some students, they might decide to repeat a class. And normally, for students who do not meet up with our assessment, it's obvious you're repeating a class because you're not going to carry over that assessment to the next class. It will affect you. So some students might um, wish to repeat classes depending on their availability. But for a section, it's 4 weeks. Every section is 4 weeks. If you're successful, you pass all your assessments, you move to the next class. So that way, you can get to the final class, which is the pinnacle.
Oh, oh,
And then,
thank
depending
you.
on your capability, some
Okay,
still roll into one-on-one tutor assessment class after finishing all. Some can still take the exam from mastery or basic class. That's our pinnacle class.
thank you.
Mhm.
Then please, the second question is, please, should in case I have the mind of going to USA initially, but I later changed my mind of going to maybe Australia or New Zealand. So you said it's
Mm,
still the same, it's still the same NCLEX.
yes. All you need to
And,
do is,
and I've already written the exam already. I have the mind of US before, but now I'm thinking of New Zealand and Australia. So I can still use the same exam that I've written, despite the
yes.
fact that I was thinking of US before.
The answer is yes. What
Oh,
you need to do, depending on the country you finally decided to settle in, you go to their nursing website, then download your candidate's test report and upload to them. Then register with the board of nursing of the
oh,
country that you wish to go. For example, a a colleague of mine took NCLEX under Texas Board of Nursing, United States of America, and midway during his immigration, he decided to now base in Canada. So what he did was to go to the website of Abata that's Canada, a state in Canada, register with them, send them their candidate test report. They looked at it, that's NCLEX candidate test report. They look at it, he was licensed, and as God may have it, he was able to get connected to an agency that got him a work. As I'm talking to you, he's practicing in Canada. Meanwhile, he started the process for United States of America. So the same NCLEX is what is being used. You don't have to write NCLEX for Canada. Then it's obvious that if you want to write, you have to register with one state for you to write. But after writing, even in USA, we have 52 states. After writing an exam in one state and you decide to switch to another state to practice, you have to do kind of an endorsement of license. So you notify the new place you're going to of your NCLEX and how you wish to switch from the state you registered previously to the new state. That way they can give you their requirements. Once you meet their requirements, you will now do your endorsement and have license in the state that you wish to practice.
Okay. Thank you. Thank you very much. Thank you.
You're
Thanks for the
welcome.
explanation. I'm good. Yes.
Sister Fatima, can I hear from you? Do you have anything to add?
No, my that's all. Thank you.
What of Sister John? Do you have a question? Okay, somebody is raising their hand. Sister, go ahead.
Thank you very much. Thank you for the opportunity. Please, I want to ask, this our Saudi Council exam and the NCLEX exam. Is there any, because someone was telling me that I have to because I told the person that if you are preparing for NCLEX before, you should be able to at least do Saudi Council exam. But she was telling me that no, that I have to enroll again in Saudi Council and that they have their own thing is quite different, totally different from NCLEX. And I thought nothing is general, is a general thing everywhere, standard thing everywhere. But he said no, that it's still different. Please, can you make more clarification on that?
Okay. Actually,
Thank you.
the council exam, their question formats were derived from NCLEX, but it's it is not as advanced as NCLEX. If you've been studying for an NCLEX and you know you're doing well, you can write your Saudi council exam. If you've been studying, you understand. If you've been studying for NCLEX and you're doing well, you can write Saudi council exam even without any tutorial. The advantage the tutorial will have is that Saudi council exam keep repeating question, and on your own, you might not be exposed to such question format. So, but when you enroll for a class, what the class will do is to give you all the questions that Saudi used to set over the years. By the time you go through all those questions, you have higher chances of doing better because they are repeating questions. I don't know if I'm making the point clear. Because they are repeating questions. So you have higher chances of passing those questions when you encounter them the second time. Unlike NCLEX is not repeating question. If you have the content, the knowledge of the content of NCLEX or nursing practice, international nursing practice, and you're moving for your NCLEX, you won't see any question that you've seen or any random question. Everything will just be new and it will be individualized. It's not the same question or the same exam that you're taking that the person close to you is taking. So that is what the computer adaptive test is trying to explain to us. It weighs your individual capability to assess a patient, make judgments. Then, when you get that, the next question coming is going to be very heavy, more difficult, more demanding. So, if you continue in that trend, you keep encountering difficult questions and you keep passing, that means you're way above passing standard. And with that, once you get to 85, the computer can say, I have judged this individual enough. She can perform safely in the international environment. So, Sister Ola, did I answer your question?
Yes, you have done justice to the question. Thank you very much, ma'am.
So, enrolling in the class will help you to maybe have higher score because you will see familiar question that you still see in the exam. So that way you can maybe recall what you answered before. It will be very easier, something like that.
Okay,
So
thank you.
Ijoma Gloria.
Yeah, can you hear me?
Yes.
Yeah. Hello. I don't really have a question, but I just want to thank you for this lecture, honestly. Hello, can you hear me?
Sure, go ahead.
Okay, I just want to thank you for this lecture. Actually, I don't really know all these, the English has this type of questions. I know of SATA, but with this lecture now, I'm able to, appreciate the bow tie, drag and drop, and highlight. Yeah, at the Pinnacle class, you sent that question. So I looked at it. I did not understand what you understand that I need to write out, that particular complication of that problem. So I was wondering what kind of question is this? So honestly, I appreciate today's lecture. Thank you so much, Rosalie. Thank you.
You're welcome.
Um, all right.
Okay, Joma, can you give them a word?
Uh,
Being with what you've gained from us and all that before we can close.
honestly, yes, honestly, eLab has the content, and I've been following from class one, two, and then now I'm in the Pinnacle class. Just like boss said, NCLEX doesn't repeat question, but when you have the content and the knowledge, you'll be able to, you know, appreciate, or you'll be able to answer any question, and then the rationale, say the rationale about it. So eLab will equip you, will teach you, will drill you and make you ready for this journey. So I will encourage and encourage each and every one of us to, if you want to really achieve this dream of traveling and then working in an international setting, you really need to stick to an a group or an academy that will build you. And I recommend eLab Solutions because they have all it takes. I've started with them, I've gone far, and Boss Lily and other tutors there, they are really, teaching us very well. So thank you, everyone.
All right.
Uh,
Thank you, EJ.
okay, okay. Thank you, Mom.
Please tell your friends that we are not able to join us. Tell them what we did here today. A lot doesn't know. And
Okay,
they see it as part of, how will I say, they will see it as surprise when they finally get to the hall. What is this?
exactly, exactly.
What is this? And for such length of question, you see that the question is so cumbersome.
Mm.
And by the time you read to the half, you've forgotten what you read previously.
Yes.
Tell your friends that wishes to make their US dream, Australia, Canada, New Zealand, because New Zealand started using English this December. this December, just last month. So if you're aspiring for New Zealand, you must have your NCLEX from this December. So it's now general, and the need for nurses is once you have what it takes, you're moving. There is no more delay. So I encourage everyone, let's make hay while the sun shine. Let's get it now so that we won't have anything to regret. Even for those that wishes to maybe continue their education, do their masters, do their PhD and all that. It's an opportunity because here in Saudi we can study, but the privilege you cannot combine it with work and all that. And considering the language barrier, it won't be that easy. But for an English speaking country, it is okay. You can adapt, you can the hospital setting that employ you will give you opportunity to for career advancement. Yeah, I don't know if there is such opportunity. Okay, someone else is raising her hand. EJ, can we hear you? Sister Jama, you're raising your hand.
No, I've actually finished. I did not.
Okay, it's showing.
Mm, yes.
So thank you everyone that participated. We hope to see you at ELA. We hope to help you achieve whatever dream you have. Thank you all.
Thank you very much.
You're welcome. Bye.
Bye bye.
Bye. Thank you so much, Boss Lee. Bye.
Bye.